Welcome to the MCI Infusion Pharmacy training module on chemotherapy spill response, designed in alignment with USP 800 and NIOSH hazardous drug guidelines. In this module, you will learn the correct process for managing a hazardous drug spill from initial containment to final documentation. The first and most critical action is to protect personnel and prevent further exposure. The responder must secure the area by stopping foot traffic and moving patients and non-essential staff away from the area. A clearly visible spill warning sign is placed at the perimeter. This step is essential to minimize secondary contamination as required per USP 800. If applicable, the responder will notify the Environmental Services team. Per Baptist Health South Florida policy, a code white should be called if the spill is greater than 1 gallon or if additional help is needed to safely contain the hazardous spill. A second trained staff member can assist if needed. One will perform the cleanup, the other will serve as a spotter to provide materials, maintain the spill perimeter, and call for additional resources if needed. The responder should locate the nearest chemotherapy spill kit. In the pharmacy, spill kits are located inside of the hazardous mixing room on the medication shelves. Additional spill kits are also located on the supply shelf outside of the anteroom, in the medication storage room, and in the med runner's cart. The responder opens the nearest chemotherapy spill kit and dons PPE in the correct sequence. First, they will put on the inner chemotherapy rated gloves. These are ASTM tested for hazardous drugs. Then they will don the impermeable disposable gown with closed front and tight cuffs. Next, they will don shoe covers. Eye and face protection is also required. Lastly, they will don the outer chemotherapy rated gloves. These will be placed over the gown cuffs. Proper donning ensures maximum protection and complies with USP 800 PPE standards. Spill containment and collection. Approaching the spill, the responder works from the outside inward, placing absorbent pads to prevent spread. Each absorbent pad can hold approximately 500 mL of fluid. To clean a powder, use a damp absorbent pad and place over the spilled powder. This reduces the spread of powder to surrounding areas. Broken glass is carefully collected using the disposable scoop and scraper from the kit and placed into a puncture-resistant sharps container, never by hand. All contaminated absorbents and debris are placed into the yellow chemotherapy waste bag provided in the kit, in accordance with hazardous waste handling protocols. Deactivation, decontamination, and cleaning. Immediately after all debris has been removed from the affected area, deactivation, decontamination, and cleaning must be performed. Use an EPA-registered peroxide-based deactivating agent, such as Paradox, to remove residual hazardous material from the surface. Paradox can be used to both deactivate and decontaminate the area. A final water rinse completes the cleaning process. PPE removal and waste disposal. PPE is removed in the reverse order of donning to avoid self-contamination. Start with the outer gloves, followed by the impermeable gown. Next, remove eye and face protection. And finally, remove the inner gloves. All PPE is disposed of in the sealed hazardous waste bag and disposed in a yellow hazardous waste bin. As a final step, it is important to complete hand hygiene. Documentation and follow-up. The responder will complete an incident report detailing the location, drug involved, estimated volume, and personnel present at the hazardous chemotherapy spill. This concludes the MCI Infusion Pharmacy training module on chemotherapy spill response. For additional information, please refer to the Critical Point module, HD Work Practice, Decontamination and Spill Management.